Stomach ulcers, natural remedies that actually work. Hi, I'm Dr. James Machino. You know, stomach ulcer is also called peptic ulcers, and sometimes they can be in the small intestine where they're called duodenal ulcers. Usually are caused by a number of factors. Usually it's a multifaceted sort of causation. Certainly the H. pylori bacteria seems to be part of the infection process that is related to ulcers. But some people can have a positive test for H. pylori bacteria but not have ulcers. So that alone usually isn't going to cause the problem. People who smoke have a greater likelihood of developing ulcers. A lot of alcohol ingestion, greater risk of developing ulcers. If you're under a lot of stress, then some people respond by secreting more hydrochloric acid in the stomach. That can sort of stir up the pot. And when you're under stress, also you're secreting more of these hormones like cortisol and so on, which have been shown not only to weaken the immune system, but to produce intestinal ulcers. And if you're using certain drugs regularly, like aspirin or ibuprofen, Voltaren, indomethacin, these non-steroidal anti-inflammatory drugs cause erosion of the intestinal lining and can lead to ulceration and internal bleeding. And there's other drugs that are linked to stomach ulcers as well. And then your genetic makeup might just make you more predisposed to the problem. So it's a culmination of some of these things coming together that usually produce stomach ulcers or peptic ulcers. Now, the medical treatment for stomach ulcers includes using what are called proton pump inhibitors, which sort of block the secretion of hydrochloric acid, combined with an antibiotic to kill off the H. pylori bacteria, and sometimes the addition of another antacid to keep the acidity low. And then they'll tell you to avoid irritants like alcohol and caffeine and smoking and so on. But there are other complementary and sort of supplements that can be used that have been shown to help heal ulcers. So for instance, chewing DGL tablets. DGL stands for deglycyrrhizated licorice. So licorice, once the glycyrrhetinic acid is removed, you have what are called DGL tablets. When you chew them up, they mix with your saliva, the contents actually have a healing effect on ulcers and stomach irritation. That should be included as part of the treatment because it's been shown also to reduce the recurrence of ulcers. Drinking aloe vera juice has been shown to help heal ulcers as well. And sometimes using sort of an oregano product, which can help to also kill the H. pylori bacteria so that your term of antibiotic treatment can be shortened. Using digestive enzymes and prebiotics helps your body digest food, less irritation to the intestinal tract. And the prebiotics improve immune system function throughout the intestinal tract by helping to flourish the growth of the friendly bacteria. And also taking a high potency multivitamin so you can help to heal the tissues of the intestinal tract, giving them the right nutrients along with the right essential fatty acids that help to reduce inflammation. So there's sort of this complementary supplementation and lifestyle program that should go into the overall global management of ulcers that sometimes is left out by medical doctors. The reason that it's important to look at these alternative things is because if you stay on acid pump blockers and antacids for too long, they decrease the absorption of B12 and calcium, and that's been showing now a greater likelihood of developing osteoporosis and bone fractures. When your B12 levels go down, you build up homocysteine. It can cause a vascular dementia, lead to anemia, and low B12 levels are also linked to increased risk of breast cancer. So having some of these complementary measures can lessen your dependency on some of the medical things that have a more drastic effect on your body, sometimes in a negative way. And if you're on antibiotics for too long, you increase risk of ulcerative colitis and developing antibiotic-resistant infections that may haunt you in the future. So this is why using oregano at the same time might kill that bacteria off a lot faster. Anyway, if you have ulcers or know someone that's had them, click on the link below to read my review article on nutrition and supplementation management for intestinal ulcers. I think you'll find it fascinating. All the scientific references are there so you'll know you're getting solid information. Now, machinohealth.com, you'll see my other research review papers. You'll see footage from my live professional seminars, other downloads, resources, and videos I've created. They're all there to help you lead a long, healthy, functional life. All my research review papers and teaching materials are complete with scientific references, so you'll know you're getting only evidence-based information from me on any health topic that you're looking for. So you should use MachinoHealth.com as an ongoing, reliable resource of health and wellness information for both you and your family. Thanks so much for watching.